Good morning, everyone, and welcome to our session on accessing tribal climate and health resilience data. I'm having just a little bit of troubleshooting here while we get our other speaker online. So just stand by and feel free to say hello in the chat. Tell us your name and who you're with and where you are. And what's the weather like where you are right now? It's 50 degrees and chilly in Power right now. Feel free to say hello in the chat. Tell us your name and who you're with and where you are. And what's the weather like where you are right now? It's 50 degrees and chilly in Power right now. Feel free to say hello in the chat. Okay, so I'm getting some feedback from Angie, so I think you might need to mute yourself for a moment. And what's the weather like where you are right now? There we go. So hello, everybody. Angie has joined us, and yeah, there's always a little bit of troubleshooting getting backstage. Some people end up in a waiting room. So she's with us now.
Hi, everybody. I'm sorry. Can you hear me?
Yes.
Okay. Hey, new tools. Fun. Okay.
Yes.
Welcome, everybody. So hello, I'm Angie Hacker, and thanks, Shasta, for kicking us off while I was getting myself acclimated. I do need to figure out how to share my screen, which looks very simple. I'm going to do that right now. Okay. Thanks for bearing with me.
All right, we're good.
Everybody sees that, right?
Yep.
Okay. So we're here for our 50-minute session on accessing tribal climate and health resilience data. I hope that this is a relevant topic for you since you've shown up. That might mean that you've had some experience trying to look for data yourself. So for the next 50 minutes, we're going to be together for an interactive and fact-filled discussion that we hope will help tribal professionals like you learn how to obtain and use meaningful data to both Western science and then trying to braid that and incorporate that with the information you have in-house, traditional knowledges and other local observations that you're collecting, and use that to inform your decision making. So what decisions are you making right now to help prepare for and adapt to climate and health impacts and build resilience? And I think folks on the line probably know, because you're probably already experiencing them, that the health impacts of climate change are vast. We're not going to get into a lot of detail today about all the various ways that climate change will affect health, but we're focusing our energy and time today on how do we know? How do we measure it? How do we understand what health impacts may be coming our way? And so because through the Tribal Climate Health Project, we have talked to so many tribes and tribal organizations and support organizations, we know that tribes are spending a lot of time, resources, and energy on trying to gather information to assess their vulnerability to these health and climate health impacts, and to try to assess their resilience to climate change in general. And so we've really taken some steps to try to ease the burden for tribes a bit, and we're excited to talk to you about that today. And so we're going to do some introductions, and I'm not too familiar with this tool, but this platform. Shasta, are people able to do some introductions over chat? You are muted.
Of course I am. No, this is, it's all chat only. So yeah, I've asked people to start introducing themselves and tell us where they are and what the weather is like where they are today.
Okay. All right. Yes. That's why I see partly cloudy and rainy and all sorts of things. Great. Well, yeah. So if you can, I'm interested in folks. I want to make this somewhat interactive. There's going to be discussion towards the end, but if you want to start thinking in terms of if you have done adaptation planning, what challenges that you have faced in trying to access vulnerability data specifically. I'm happy for you all to continue to drop information into the chat or thoughts into the chat. But otherwise, your name, organization, location, work. So again, Angie Hacker, I'm with Prosper Sustainably. I'm the lead consultant under Shasta. Shasta's with the Paul Bannon Mission Indians, and I support her with the Tribal Climate Health Project. We're going to tell you more about that. And then once I give you a little bit of an overview about our program and what we're trying to achieve, I'm going to talk to you specifically about our data development efforts and how we're trying to do that work of easing the burden on tribes and building capacity there so they can move forward away from, what can be a debilitating phase of fact-finding into what could be a really important phase of action and taking steps to actually adapt. So with that, we're going to do some demonstration of our tool and really which is an introduction to many tools out there that can help tribes access data that can help them make decisions. And then I want to have a discussion with you all about your experiences and what you're seeing in terms of both gaps in data or difficulties accessing data and solutions. All right. So Shasta, feel free if you want to chime in at any point here, especially on this slide, because all of this began with Shasta and the Paul Abandoned Mission Indians, which is located in northern San Diego. Do you want to say anything here?
Sure. So this is where the Tribal Climate Health Project began. We had some funding from EPA to start to develop tools for tribes to do vulnerability assessments and planning for the health impacts of climate change. And we got that money in 2016, and we know what else happened in 2016. Trump was elected, and so that meant our money, although it wasn't defunded, was never allocated. So we had to scramble and find funding other places. But fortunately, the BIA stepped up, National Indian Health Board through the Centers for Disease Control. And so we were able to put together this great advisory group and working with Angie and Prosper Sustainably to develop these collaborative climate adaptation planning tools and capacity building. And this is, I think, year 5, I guess, that we've been working on this project. And right now we're really focused on data. And so that's what we're talking about today.
Right. So we, a lot of what we did, we started doing, we were building capacity, and we thought that meant, trainings. And so we've done lots of trainings. We've trained over 1,000 tribal serving professionals. And that meant diving into a lot of research and to try to build out a curriculum to do our best to walk folks through the process of what it would take to really get prepared for the health and climate impacts coming their way, which, a lot of that meant, how do you do a vulnerability assessment that incorporates health impacts? How do you get an adaptation plan ready? What happens next? And in that process, we learned that there's tens of thousands of data sets out there that are really wonderful and all part of the puzzle of trying to figure out how almost everything we care about is going to be affected by climate change, including health. And so that became overwhelming, and it became clear that it would be impossible in a training to just be like, hey, here's 1,000 places to go find information. Good luck. So instead, we decided we were going to organize the information as best we could into our own tool that is attempting to make it easier to sort through all the different ways that you can look for indicators and data sources externally and weave that in with the internal information that you have to make it a lot easier to get to the point where you actually have a plan. And so that's what we've been working on for about the last 5 years. And like Shasta mentioned, that sort of landed us into this really deep dive into data. And so one of the things what we have done is sort of parsed off from the Tribal Climate Health Original Program, parsed off some additional efforts on data development, and super fortunate to now have received several rounds of funding from the BIA Resilience, Tribal Resilience Program to do this. And so we have now 3 rounds of an intertribal resilience data development effort. And what means is that we have the effort here, the objective is to support tribes locally, statewide, and nationally in the development, analysis, and ongoing monitoring of epidemiological and other data sets for adaptation planning and resilience decision making. Epidemiological is just another way to kind of say health data, which we felt like in looking that there's some really good information, and either tribes didn't know how to access it or just didn't know where to go for it, or that there might be some need there to actually develop the data further in a way that is ready for tribes to use. And so the goal there too is to increase the capacity of tribes to prepare for and address basically their climate impacts. And so those projects, like I said, there's 3 rounds of them. We have focused primarily in Southern California. So we started, because Paula's in San Diego and has such a great network of other San Diego tribes, we started our first round in late 2019 with a San Diego-based project. 6 tribes in San Diego together went through a process where we compiled all of their available tribal resilience data. So if you've done this work, you imagine that's nice. It was basically free consulting using the tool that we had built to try to test out how well does this tool actually work for tribes in San Diego. Where are there additional gaps where the tribes that are participating still felt like they weren't able to access meaningful information to make decisions? And so it helped us identify and prioritize key gaps and needs in the data. And so we basically parsed through all the data sources that we were aware of, presented the data, asked them for their feedback. What else are we missing here? What else do you need to make decisions? And then actually went out and got more data. And so we worked with the California Tribal Epidemiology Center and ended up developing our own data request protocol for a tribal climate and health data set that California Tribal Epidemiology Center can provide by request. And so that's a new sort of asset. So anybody, at least in California, right now has a very easy process now to say, hey, I want to go, I need whatever information that is available that CTEC can provide that is relevant for climate and health information. So for my vulnerability assessment. And so beyond that, though, we're doing a lot to try to just find other solutions. So collaborating across the board with national health and climate experts and doing our best to find now other data sources and do a better and better job building on our own tool, pointing people to the right tools, including what we're working on now is developing a pilot directory of vulnerability data contacts for tribes, which basically means once you're starting the process of doing the analysis you need for your vulnerability assessment, who can you talk to? Who's already resourced in some way to provide support? So, because we work with so many communities, so many tribes, we know that the head spin a lot in the very beginning of this process of trying to do a vulnerability assessment. We want to point you in the right direction to get the help you need, either from humans or from some sort of data set. So I want to put this in the context of why it matters. And why it matters is because a lot of folks, the first step in doing the work that needs to be done on adaptation, meaning preparing a community for health and other impacts of climate change, is to do a plan. And a plan typically is a couple of phases. So in the climate change world, a plan typically looks like a vulnerability assessment, and then an adaptation plan. And so in our trainings, we talk about climate vulnerability, means to prepare to address the impacts of climate change on your tribe. And we're saying it's critical to first understand your tribe's unique and most significant vulnerabilities. And vulnerability for us is a sort of a function of several elements. And so one is, what's the exposure risk? How severe and likely is it that an exposure is going to come your way? And we'll talk about what does an exposure mean, but it's basically what kind of a climate condition is changing that is creating some exposure to your specific location. Plus, what kind of an impact is that going to make? So yeah, heat is coming. And why does it matter? How will it affect your natural systems, your built systems, your health and social environment? So how will it affect the things that you care about, which is what we call valued assets? And that could be anything from, your levees and culverts and hard infrastructure to your educational opportunities, to your ability to maintain your economic drivers, to your, the health of your community, the mental health of your community. So along with that, an additional level of risk could come from population sensitivity, which basically would mean, does your population, does your community have certain characteristics that make it more sensitive to these climate changes than others? So for example, if we know, and we do, that heat is going to continue to be a problem for California and for everybody in this EPA Region 9. If folks have a community with a high urban heat island effect, that might increase the level of sensitivity, which, a lot of concrete or not a lot of tree canopy or shade, or households that don't necessarily have air conditioning, and so they can't cope well when a heat wave comes through, or populations that have a really high proportion of elders are particularly vulnerable and sensitive to heat. Those kinds of things increase the risk even further. And then you can decrease the risk of vulnerability through adaptive capacity, which might mean things like what solutions have already been implemented that can reduce risk. So say your tribe has already implemented a cooling center, and you've got some power backup systems so that when a brownout occurs or even a PSPS event with a wildfire, you have some level of critical facilities that are going to maintain power, and people can go somewhere where there's going to be some level of electricity and cooling. So that's the kind of things we look for in data. So how do we know how big the exposure is? Well, there's data for that. How do we know how big the impacts are going to be? There's data, there's population sensitivity data, there's adaptive capacity data. That's a lot of types of information to go find. And like I said, can be overwhelming. And so in our trainings, we try to walk folks through the steps of how to do a vulnerability assessment. And there are about 6 kind of major steps, and we walk them through in some level of detail. But 3 and 4 are really data heavy. So, first you're going to determine your objectives and scope, then you're going to do a lot of engaging your community throughout. And all of those are such important pieces. And then we spend time identifying what key indicators. So what do we want to look at to measure the severity and likelihood of the vulnerabilities that are coming? And then you go out and you gather and analyze a ton of information. And often a lot of you hire people like me to go do that kind of work for you, because like I said, it's overwhelming. But that's why we created what we're calling our exposures, impacts, and strategies inventory tool. And so we call it EASY. It's a word-based tool, and I will show it to you. And it's attempting to kind of take 3 and 4 from being what is almost an insurmountable task if you've never done it before, to something that is at least is pointing you in the right direction of where to find information and gives you a place to make those kinds of decisions about what the information is telling you. And I'll tell you more about that. So here's my little introduction to the EASY tool. Like I said, I'm going to demo a little bit of it, and I want to actually show you too how it points you to data sources and give you some examples of the data sources that are available to us. But the EASY tool was built as a companion to the tribal climate health trainings. We've done lots of webinar trainings, a little bit of in-person trainings, and it was attempting to ease the fact-finding burden on low-resource communities and free them up to do the work instead of spending all their time looking for data to make meaningful community-driven adaptation decisions. And so it is a filterable, customizable worksheet to evaluate and track your vulnerabilities and adaptation strategies too. So we're focused today mainly on the vulnerabilities, but this also does help you attach, once you know what your problem is, what your vulnerabilities are, then you can attach a strategy to it. So you try to address that vulnerability through adaptation strategies. We have a tab that can help do some of that finding and planning of adaptation strategies. And I'll show all this to you, but in general, it attempts to suggest and organize indicators and accessible data sources for all those things I just talked about: the exposures, the secondary exposures, impacts, population sensitivity and adaptive capacity, and those valued community assets. So on the left there is our framework that we use for the Tribal Climate Health Project. And so those top level exposures, primary exposures, we categorize as 5 things: temperature extremes, wildfire, storms and flooding, drought, melting ice, and sea level rise. Those are the primary exposures driven by climate change. Those cascade into multiple effects. So it cascades down to secondary exposures, meaning other conditions that you're not in control of that are going to change in your climate. So that would mean things like worsened air quality. So we know that wildfire is going to lead to episodic smoke waves or increases in PM 2.5 particulate matter. And that's going to be an irritant on lungs and cause respiratory health issues. And so it affects air quality. Vector changes. We know that heat changes the breeding patterns and distribution of vectors that result in vector-borne diseases like Lyme, West Nile virus. Water insecurity. Drought obviously leads to lack of supply of domestic drinking water, and things like storms could affect the quality quality and pollution of waterways. Food insecurity as well. We know there's lots of different ways that climate change can affect the availability of food, whether it is through growing food or by distribution of food. And all of that has impacts. So we talked about natural, built, and health and social environment. And so those are all the kinds of ways that we organize ourselves and try to organize information to make decisions. So with that, I'm actually going to show you the tool. Let me populate up here. First thing I want to do is actually show you where the tool lives. And Shasta, feel free, if somebody's made any kind of comment or question, just to chime in and let me know.
Yeah, I mean, I've encouraged people to start thinking about their tribe's data needs. So if you want to start putting those things in the chat, what kind of data do you need for your climate vulnerability assessments or for your planning? Things like weather data or health data or rainfall amounts, drought patterns. And I also put the link to the Tribal Climate Health Project website in the chat.
Perfect. Okay. So this is our website. The way to drill down to find the easy tool, there's a few ways to do it, but under training materials, if you scroll down, it's right here, the adaptation planning tool, and it's an easy download. You just click it and then you download it into an Excel tool. So it'll basically populate up like this. And there's several tabs. And here's that framework I talked about. What this also does is link you over to a full guide, which I'll talk about in a minute. So you don't have to ferociously be taking notes or anything right now. It can walk you through some instructions for how to use the tool. So, we call it the easy tool. It's easier than having nothing to support you, but, there's some work involved. And so, but I just want to guide you around some of the functionality here. So this first tab is on exposure. So like I said, drought, heat, melting ice, sea level rise, wildfire, storms and flooding. Those are all of our primary exposures. And that's how this tab is organized. If there is a secondary exposure associated with it, then it's in this column B. But say here we have drought. One secondary exposure would be worsened air quality, because we know that the research says that drought also contributes to dust particulate matter. So it's organized this way. What you could do, if all you had was 2 minutes, is to go in and filter for your region. So say the Southwest, it would try to contract down just those exposures and secondary exposures that are most relevant for you in your region. But you don't have to use it that way. If you want to look at all the exposures, regardless of what we think the research has said are the most key and important to you, you can. But what this does is basically say, all right, well, how do you know the drought is going to be a significant problem for you? Well, you probably have a hunch, but there's some data to look at as well. Here is a whole menu. This is why we call it an inventory of possible ways to measure that. So we'll call these indicators. Let's go to the top here. So there's a lot of different ways to look at drought. Here's one, extended drought scenario. So obviously you're going to look at precipitation, days of precipitation above 1 inch, average annual precipitation, days of no precipitation or dry days. There's lots of different ways to word information, and the wording becomes important because the data is specific to how the indicator is worded. And so what we've done is we've looked through all the best practices of what are other communities and the state and federal agencies saying are the most important pieces of information to look for, and then where is the information for your specific region. And so say for days of no precipitation or dry days, we can get that down to a county level. We'll talk more about that. And one place to look for that is the Climate Explorer. It's a nationwide tool, and here's the link to it. And so we have a whole set of national data sources and state data sources. Both of those, we parse that out into historical, baseline, and projected information. So not all pieces of data have all of these elements, meaning I might know days of no precipitation from from the year 2000 to the year 2019, but maybe there haven't been any projections made. And so maybe I don't have access to that. Maybe I wish it went back to 1950, but it's just not there. And that's our life. We wish there's more data and we wish it was easier to access, but we take what as best as we can get.
And that relates, actually, I'm going to jump in here because I'm monitoring the chat. Terry Logston from Lake County, she says Lake County needs weather data as a whole. The historic data is from another county per National Weather Service. We also have no EPA air monitors, only purple air, so no real historic data. How do we get around that? And of course, the wonderful attendees are making all sorts of suggestions for a CARB grant for air and that sort of thing. And then Micah Knox from Saboba is also interested in air quality data. So maybe you can show a couple of examples, like for Terry's question about the historic data for Lake County. I don't know if it's you said there's a county explorer. So maybe for that, Terry, it might not be that simple if they're not doing historic data for Lake County in particular. But this is a place to check, is within this tool, to see if there's any information that could be useful for your community.
Well, yeah, why don't we'll use you as the example if you want, and we'll show you how specific tools get with location. I'm interested in your dilemma that you're getting other level county information. I imagine it differs from across the board. Every data set is using the geography functionality differently. So let's look at it. Let me get through this, and then we're going to look at some examples. So this is Climate Explorer is one of about 1 billion different data sets, and I feel like every day I'm finding new ones, which is why we put them together here so you could find them more easily. And we're going to look today, we're going to look at Climate Explorer, we'll look at the CDC tool, which is a health tool. There's a long list here. And what this does is basically say, well, you don't have to do the research to say, okay, I know that drought and heat are probably a problem for me. Now where do I go to look for information? What are the relevant exposure indicators? We've done that work for you. We pointed you in some suggested places. If you have better places to go look for that data, and maybe you're already got some of that in-house, by all means, use the most specific, most relevant data you can find. This is a place to go start. Okay, same. So, what you do here then, this is also a worksheet. So you can actually place information that you find in historical baseline and projected findings here, and that will help you come up with a exposure risk level for drought. Find as many of these as you feel is relevant, look across your findings, try to assess whatever trends are occurring, and then you're going to choose high, medium, and low for whatever level of risk you think drought presents in terms of its severity and likelihood to come to your community. Then we have a whole nother tab, and it works a very similar way, but it's on impacts, and you won't find this a lot of places. A lot of times what you find is that there's some level of, all right, we know precipitation, heat is changing for you. We know your population is sensitive. Maybe you've done some things to build capacity. But then there's a huge level of assumptions that they're leaving to you to make about why you should care and why it's going to affect the things you care about. Here, we're actually making it very explicit based on the research that we've done to say, for example, heat. So temperature increase. We have a whole list of possible impacts here on this row. So heat-related stress, illness, and death. That's a whole impact area. It's categorized as a health impact. We have different impact types. And here, again, are all the impact. Here's the indicators that we have found that we find to be relevant if you want to be measuring your severity and likelihood of this particular possible impact. So You've already looked at whether or not temperature extremes, heat is going to be an issue for you. Say it is, and probably it is. All right, look at all your possible impacts. Look at whether or not they are actually occurring for you. Maybe there are some projections already available. And then you're going to do the same kind of thing. You'll plop in here your findings, and then eventually you're going to look across the information and come up with a vulnerability level for that specific impact. And so that's my really, really high. There's more that this tool does, but I want to make sure you're aware that it exists and it has a lot of information in here. You don't have to make the connections to say, well, what possible impacts could happen as a result of these exposures that are coming, and where can I go for information? Okay. So let me get back to my, here's what I wanted to do. So I want to give you, I've provided a lot of hyperlinks here. So you can go right to these online data sets. And oftentimes they're tools with visualization charts and cool functionality that you could even take to drop into your reports. You can take a snapshot, drop an image and a graph into your report. It's pretty handy. So for example, like the Climate Explorer. Here I have San Diego County, but we were just saying, what county do we want to be looking at?
Lake County.
Okay. Lake County, California, right? All right, Here we go. So a lot of these tools will allow you to look by geographic location. Climate Explorer, like a lot of them, sadly only goes down to the county level, but still, better than nothing. What we wish is that everything went down to a tribal boundary. We'll talk a little bit more about what we're trying to do to get folks to do that a little bit more. Okay, so here, this is kind of cool. This is a chart. It's showing you a range based on historical data from 1950 to this, something more current would be baseline. So maybe you'd be looking at a 30-year average from 1990 to 2020. And then future, what's great about Explorer is it does provide projections. And so this one, we're looking specifically at average daily maximum temperature. You can look at that as a chart. You can also look at it as a graph. A lot of times folks do want to use like a 30-year average. That's kind of the industry standard for, you don't want to look at year by year because there's so much fluctuation between years. Using longer averages does help. And so this is helping. What you really want to know here is, are things changing substantially enough for me to be worried about, that I know impacts are going to result from this, and I want to get prepared. You can also look at it like this as a map, and you can kind of see how well you're doing in relationship to other communities. So this kind of a tool does a great job of compiling historical baseline and projected information in a visualized way that makes it easy for you to interpret. CDC is another one. The National Environmental Public Health Tracking Network is a great one. I use this one all the time because it's health-based. And so, for example, this one I'm looking at an indicator for drought, historical drought, total number of weeks a county was in drought from 1980 to the present. And so here it's giving you a color-coded map. And Lake County, where is that? Somewhere up here. We could look at that. Where is Lake County? It's one of these. Anyway.
Little lower. It might be the yellow one. YOLO.
Oh gosh, now I need a geography lesson. Lake County, you're up here somewhere. Anyway, I want to share this with you because it's such a good source of information. Again, most data sets are down to the county level, and that's a problem, but it is at least better than nothing. And in some cases, you only get to the state level, and that's even worse, but it's also better than nothing. Sometimes, if you're truly lucky, you get down to the census level. But before I move on to one that does that, I just want to show you how this query works. So the Easy tool points you directly to a specific query, but if you wanted to do your own query for all sorts of information that's available in this tool, it's just so great. All sorts of measures that you can be looking at, like say heat and heat-related illness. You can look at heat-related emergency department visits. You could look at, we're just going to do number of emergency department visits. This one only goes down to the state, right? So bummer, but we'll take all the years and we'll go and we'll look at that. And it doesn't have it for all, even the states. unfortunately, for this particular one.
But we do have Arizona. Arizona is one of our Region 9 states. Oh, there's California.
Yeah, we had to go back a little bit in history to find it. But so for 2015, there were over 5,000 emergency room visits for heat-related illness. Okay, interesting. So if you want to make the case that maybe that's more, let's look. Let's see how far back it goes. Is that more or less than it was in the year 2000? Well, we don't know because there's no data there. I'm glad we're doing this because this is real life. You get pieces of information and not the full piece of information. Okay, so back in 2005, it was only 3,300 emergency room visits. So you see an increase, but you wouldn't want to make an assumption there because, right, that's just 1 year. You would want to take an average of at least a few years.
Plus, it's 1 year, but it's the entire state. So, I would guess that the majority of those 3,300 heat-related emergency room visits were in the South and the Central Valley, but probably not so much in the Northwest corner. So sometimes you're taking a broad view, but we're trying to figure out where the data is to be able to, again, drill down into the specific regions, at least at the county level.
Right. And so here's one that does census level. This is called the California Healthy Places Index. This does a great job on health outcome data, and it also provides good population sensitivity data as well. And it goes down to the census tract level. So, and what else is really cool about it is it does like a relative metric for you, meaning not only does it tell you your number. So say if we want, let's look at something. Let's look at outdoor workers because that's a population sensitivity factor. So let's see here. So if you are, this is a census tract. I don't think that this is in Monterey County. So this tract has healthier community conditions than 37.2% of other California census tracts. So that's what I mean. This isn't as specific as saying in general, this tract is healthier than 37.2% of other California census tracts. So it gives you like a relative information, how well you're doing against other census tracts. But you can look at all sorts of indicators, and I would welcome you to sort of explore those. It goes from economic to social, transportation, clean environment, healthcare access, lots of good information in there, and some things that are very specific to climate change. So they have some wildfire risk, sea level rise. Speaking of wildfire, one more thing I do want to show you is wildfire risk to communities. This is a federal site, and it's recently been launched. It's really good. It's one of the best ones I've seen. I've just done it for San Diego County, again, down to the county level, but at least it maps it so you can kind of drill in to where you're at. And so it's showing you risk to California homes and sort of where you are at compared to other communities. And so San Diego's county is pretty far in terms of wildfire consequence and likelihood compared to other communities. It has a lot more information. So that's just it's high level, showing you all the types of information you might be able to access from our easy tool. So let's get back to these slides, and we're going to try to get some conversation going in here. So, like I said, we did work with CTEC, so we have some additional data sources. One of the things we were looking at, a data gap we were trying to fill, was to have more information about mental health. And so CTEC does provide some indicators associated with data health that basically you would do a data request to them. You would get a data set that incorporates all of the indicators that you see here with our sort of beautifully categorized as healthy mind, healthy body, healthy community. So it's just a lot more information. They don't have it on a data, like some website. You do have to do a request, but the request is very easy and you don't have to do a lot of thinking about even what you're looking for. It'll come as a spreadsheet, and it will also come with some nice tables that they've done some analysis for you. All of that is explained here in our Accessing Tribal Climate and Health Resilience Data Step-by-Step Guide. And you'll get access to this slide as well. You can reach out to CTEC directly to get access to that kind of data. They have special authorities to go look for health data for you and sort of do it with the parameters that you probably are looking for.
So we just got a comment from Ryan McIntosh. He says, this is a wealth of data. This could be a good 2-day training to look into putting together. And my response was, we are planning in-person trainings. We're planning on having a full-on climate data, what are we calling it? A climate data thing.
Yeah.
Event in person in 2022. So be on the lookout for that. I'll be sending it out to all of our contacts.
Thank you. Yeah, I feel like we should have paid you to say that, but yes.
I am getting paid. It's my grant.
Oh, that's right. That's right. Me too, I guess. But yeah, we're super excited to do this in more detail. We always do these short little snips, and it's just not enough. But it's a nice teaser. And if you want more information, you can contact us anytime. So I want to, now we're turning into discussion where I'm really interested to know more about your experiences and what you can share on top of what we already know. And so some of this has come up. What we already know about data gaps is sometimes data is missing completely or only available in these scholarly articles that nobody wants to parse through, and it hasn't been pre-calculated, analyzed, visualized, or made community ready. So we used to say that happened a lot in allergens and allergy rates. Like, how are you going to go find allergy information for you? More and more it's becoming accessible. So that's one area that we have found some data sets now that are pretty good. Often data is not location specific enough, right? We just encountered that. We almost never can find something at a tribal boundary. If we're super lucky, we found a census tract. But more and more, we're trying to encourage folks to do tribal boundaries. Sometimes we're missing timescales and projections. Almost all health data doesn't come with a projection. So say if you want to know, if you really want to tell your tribal council, hey, heat-related illness is going to be a huge problem, well, you're making some assumptions based on what the historical trends have been and what it looks like today and what maybe some reports are telling you. It would be great if somebody would also do some modeling and projections on what heat-related illness could look like for you in the next, say, 50 years. And then oftentimes our data is episodic. It's not episodic. It's hard to attribute it to climate change. So things like you might be able to access an annual PM 2.5 count, but you won't know whether or not that was because a wildfire went through or because or maybe your ozone levels have changed. You don't know necessarily, is that a function of heat or something else? So that's a really high level overview. Over on the right are some things that we've heard from tribes that we are working with about the types of information they wish they had better access to. So I want to stop there and ask you, what are you looking for in data? What have you stumbled over where you just can't find what you need?
Or also feel free to tell us that if you haven't started looking at data at all and you just need some help to get started.
Yeah, I have some prompt questions here. Are folks able to unmute themselves, Shasta?
No.
They're not. Okay, so chat only. So it might take you a minute, but I'd be interested in your just what's it been like trying to find data if you've tried to do this for climate change. Have you done it for health? What do has it been frustrating, overwhelming, easy? Maybe you found the wormhole in the universe that we all should know. And then if you.
And while we're waiting for people to let us know what their barriers have been or what kind of data they need, I can tell you that in Paula, we're starting on this. It's been our experience that has allowed us to start developing these tools that Angie has created. We were having trouble finding what we needed. So one thing that we did was we reached out to our local Department of Public Health in San Diego County and found that they actually were interested in a lot of the same things that we were interested in. And so they were interested in partnering with us to help us develop and get the data that we needed for things like the effects of air quality on those with asthma or people with chronic obstructive pulmonary disease, or what are the impacts of heat on people's ability to access cool places during an extreme heat event. And I know a lot of us in the more remote areas, we've been subject to public safety power shutoffs during wildfires, and those tend to coincide with high heat. And so we have people who might be losing their electricity, and that means that their medical devices, if they require electricity, those medical devices are not able to work. So it all becomes intertwined, and things that we might not have considered as health impacts and more as just general climate impacts, we end up seeing how everything impacts basically human health. And then, of course, also the health of our non-human relatives, the plants and the animals, the air and the water. So now you guys have all gone quiet.
Cindy,
here's one. Yeah, go ahead.
We have some land conservancy and local committee like the Mono Lake Committee that have some good historical weather and lake level data. Yeah, sometimes that's what you got to do. Your locals have the best information. Nobody's pulled that together, aggregated it into some nicely filterable, mappable tool yet. But more and more, I think we're seeing, state agencies, at least here in California, trying to do some of that. And then there's risk there too. So we probably don't have time to go into that. But I know there's some concerns when too much information becomes too accessible. So yeah, definitely grab whatever information you have in-house. What we've tried to do is compile the information that you might not have available in-house. Christina says, I've not started looking and came here first to be educated. I love all the information and absorbing it all. I want all the data. We like you already. Come be our friend. I hope you come to one of our trainings someday. But man, guys, just download this tool and start tinkering around. It's easy as that. We don't care if you mess with all the Excel document either. Customize it to whatever you need it to be. Just, I hope it's useful.
I recommend that you download a copy and keep that as your master copy, and then make a separate copy to start messing around with, because if you're like me and Excel is your kryptonite, then you end up like messing everything up and just have to start over. So keep yourself a clean copy, and we do occasionally make updates to it. The current version was last updated in May.
So John's given us some help here. He says, I've gone through USGS for current monitors and water levels, and I've examined topographic maps. What we wonder is what pre-industrial water levels were for upper and lower Klamath. Yeah, so far I haven't found any direct answers. Yeah, that sounds right. Every time I go looking for water level information, I think I'm close, and then it's not really there. But I do know that at least in California, there's a lot of efforts around stream water or stream flow data to try to make it more accessible. Maybe somebody here knows of something that is really great. Thank you, Sally. Yes, thanks, Shasta. I'm accepting all new friend requests. Okay, Christina, done. All right. Anybody else want to make a suggestion about, hey, what's the greatest data source you've found that has really solved a problem for you? While you're doing that, type it into the chat, because I'm collecting all that. I'm just squirreling away. I'm like a hyper user of data. I'm not a data scientist, and I'm always on the hunt, squirreling away more data sets that I like. While you're doing that, I'm going to share you what we're doing a little bit more. So like I mentioned, we have all these intertribal data development projects going on. Right now we're in SoCal. We're working with a new set of 6 tribes. We're going to do some more refinements of our EZ tool based on what we learned about data gaps. We're going to go work with other agencies to see what other data we can request or identify. If you're in California, probably by next year, you'll see a questionnaire come out from us where we are trying to look across California to see where the data gaps are. And so look forward to answers there. And then like Shasta said, we have a training coming up next year. We also have that directory I mentioned where we're going to try to compile the right contacts of climate and health adaptation planning assistance providers. And then we also are doing this. One of my favorite things I'm doing in life is facilitating with Shasta a national tribal resilience data work group. So that's about over 30 experts from across the country on all the data, the data experts. They care about tribes, they know climate change and health, and we're coming together on a monthly basis to look at tools and figure out why what's available now is not good enough for tribes, and where can we make improvements? Where are the solutions going to exist so that tribes can get past get past this fact-finding stage and get on to adaptation and action. Along with that, lots of other coordination among state and federal agencies. And believe me when I say that they're really looking at this. They may not have figured it out yet, but we're in the right place at the right time to try to inform up some solutions here and make things a little bit easier for tribes. So join us. Join us on our journey. And I want to just invite you to go ahead and go do the data requests. And if you do want to go to tribalclimatehealth.org, you can sign up to be part of our listserv and be around for any trainings and other opportunities that we offer, which come around pretty frequently. With that, I want to say thank you. Shasta, any parting comments?
No, just no, and then I give comments. Yes, thank you everybody so much. Again, Ralph is asking where to go to download it. It's right above where I posted tribalclimatehealth.org training materials. That's where you find it. Let me put it into the chat one last time. There you go. And also we will, we have these materials in the session underneath the details tab below the screen. And I'm going to be uploading a copy of the tool, although it might be too big. So the best thing to do is go to the website and you can download it directly from the website. So we are just excited that you all were here, and thank you so much for your comments. And again, you can reach out to Angie or me anytime if you want to learn more. Let me rephrase that. You can reach out to Angie anytime because I'm so busy right now. But after the conference, you can reach out. And thank you again, everyone. We appreciate you and hope to be working with you soon. Bye.
Thanks, guys.